Right. And we should be live there. So, good night, everyone, and welcome to the first episode of the NAPRIMA Association of Past Students, N.A.P.S podcast. I am your host, Yadav Mohib. I am also the Public Relations Officer for this current executive. Now, seeing the times that we are going through as a nation and as a world, we have to find innovative ways to engage our membership and the public at large. And that is why we have taken this step towards the N.A.P.S podcast to build that spirit and that camaraderie among the membership, among the past students. And today we are looking at a topic which is affecting not only our community, our N.A.P.S community, but the country at large. And that is, in particular, the COVID-19 pandemic and our upcoming vaccination drive, which is coming up on the 27th of November. So, without further ado, I'd like to bring on my co-host for tonight, and that is another executive member of the current executive of the N.A.P.S Association, and that is Dr. Mitra Maharaj. Good night, Dr. Maharaj.
Hi, pleasant good night, everybody. Pleasant good night, Yadav. How's everybody going tonight?
Well, it seems everybody going decent. So what we like to say in these things is share up the live. So if you have the link, share it up to your groups. Let's know that you're seeing us. Talk to us in the comments because it's always a learning curve when we have to handle a new audience. And this is our first podcast of this nature. So we really need to get that feedback from you all to know that you're hearing us good, you're seeing good, and all of that. So Mitra, the
Yes.
Naps, the Naps, the Naps podcast. When you think about Naps and I think about me, it's a whole different um relationship we have now than when we first met.
Yes,
You
for
and
sure.
when
Um,
we first,
our relationship started back in Temple days, and
right?
then in school, and then now being on the executive together as a whole totally
And when
different
and
ballgame.
when I was in school, you was my partner. You was a student, and I was a teacher.
Well, first he was my prefect, and then he became a teacher.
So it always had that, the ranking thing. But now we ranking together. You understand?
Yeah,
But we know how it go. Past a certain time, everybody, that rank just kind of break down a bit. But it's had to pull up on other small men too. All right. So, Mitra, you being a doctor out there, in the service right now, what is your experience and the current situation at hand when it comes to, the pandemic and what we actually seeing right now with the rise in cases and things? Is it something that you all are, you know, handling well, would you say, or is there some hurdles overall?
Well, so the department I currently work in, which is the occupational medicine department in San Fernando General, we deal directly with COVID. I don't deal face to face with COVID patients, but I deal directly. COVID is my entire job, essentially. Um, I see about the staff members in the SWRHA, all facilities, um, with the um, contact with anybody who became positive if they become positive for some reason. And trust me, it's been a hell of a ride, um, from March 2020 till now. We had the waves; it was going good for a certain point, and now we're really
That was
back in the
short lived.
trenches. Yeah.
Yeah, that was short lived. And I mean, so when you talk about contacts, right now, contacts is like, wow, when you're talking about people having primary contacts, secondary contacts, cases, and the contacts is just like, you
Correct.
know, me
Yeah,
being in the
contact.
secondary school system, it's right now, the contact tracing is everywhere. You always know somebody you can call up as a contact, you know. Um, but tonight we don't have just Dr. Maraj. Dr. Maraj reached out to some of his colleagues and superiors in order to get this panel going, which is surprisingly or unsurprisingly for some people, full of N.A.P.S alumni, right? Some of whom I've never met before. So to start us off is a gentleman who I have never met before, and this is Dr. Mark West. Good night, Dr. West.
Good night, gentlemen. Good night, Yada, and good night, Mitra. How are
Now,
you all?
we're, we're great. We're great. I mean,
Good.
as good as we could be, right?
Yes.
Now, Dr. West is a consultant cardiothoracic surgeon. He is stationed at the Eric Williams Medical Sciences Complex. He would have received his degree from University of Ireland, and he graduated in 1990, where he obtained his FRCS in 94. And obviously, he specialized in cardiothoracic training in Ireland and Scotland. And he was awarded his FRCS CTH, if I'm saying that correctly, in 2008. He has published extensively in various professional journals, such as British Journal of Sports Medicine, European Journal of Cardiothoracic Surgery, Interactive Cardiovascular and Thoracic Surgery, and has made a number of presentations to various organizations, such as the Society of Cardiothoracic Surgeons of Great Britain. So it's a lot of lecturing and so on, Dr. West. So I'm glad you could be here tonight to speak to us about your expertise and so on. But before you get into that, what year did you leave Naprima College?
I left in 1981, so a long while ago.
But
Some of
before you
my
get into that, what year did you leave Naprima College? I
some
think
of my I
I
left
think
in 1981.
I
So
think
a
somebody
long
has
while ago.
another window up
Some of
with
my
it playing,
What year did you leave
so it's
Naprima
feeding
College?
back. I
Some of
think
my I
I
left
think
in 1981.
I think somebody has another window up with it playing,
What year did you leave
so it's
Naprima
feeding back. I think
I left in 1981.
so. We get enough feedback loop. Dr. West, could you mute your mic for a second? I'm not sure what would have caused that. All right,
I think it's gone
Mitra.
there. I think it's
Yeah, but Dr. West, probably check and see if you have any other
Or mute my
tabs
mic.
open.
Sorry. Let me
no. I think it's gone there.
Well, it's gone there. Whatever you did, it's gone. But this is what happens when we get into the live setting. It's always a different challenge, but we always get around it. Mitra, could you bring on the next speaker quickly for us?
Yes. So the next speaker we have is Dr. Roshni Bisundat. Got her primary medical qualification from the University of the West Indies, and she went on to specialize in the field of obstetrics and gynecology. She did her specialist training in Manchester and Cambridge in the United Kingdom. She became a member of the Royal College of Surgeons in 2008. Since then, she has worked in the Tamara General Hospital, the Augustus Long Hospital, and now she's a consultant based at the Southern Medical Clinic in San Fernando. So, Dr. Bisundat.
There she is. Dr. Bisunat, you have to unmute your mic. I think, eh?
Hi, good night, everyone.
Good night. So, Dr. Bisunat, with what I didn't mention, what Mitra didn't mention is that Dr. Bisunat also serves on the current executive of the Naprima Association of Past Students. So we have with us 3 executive members tonight and some past friends, but Dr. West, we didn't get to hear about the year because of the feedback loop. What year did you leave Naprima College?
I hope that we don't have the feedback now. 1981. So I have gone back a bit.
Yeah, gone back a bit.
There's a guy called Michael Dowlat. You might remember
Right.
him. He was my year. And our principal was Alan McKenzie. So, and
The
at
legendary
time,
Mac.
the legendary Mac, yes. I served as one of the head prefects at the time, so that was great. And at the time, we had only just started introducing young ladies into sixth form. So and the tradition continued. When I say reintroduce, in fact, Naprima has extensive history, and my mother actually had attended Naprima College way back when they worked, and then they phased out the ladies, and then they brought them back. So it was a great experience.
Well, when I was in Form 1, as I would have said in, I think, the last one, it was phased out again. So maybe we might see and another phase coming in soon, because it is always good for us to have the female alma mater. They bring so much more to the experience of the alumni, that we can call on the females to act for the alumni and to give that female presence and that connectivity to the females in society. And tonight we are going to hear Dr. Bisuna talk a little more about that. But up next we have Dr. Munisar. Can you tell us a little bit about Dr. Munisar, there, Mitra?
Yeah, so Dr. Murisa is someone I actually worked under and worked with while working in the San Fernando General Hospital. She's a specialist emergency physician and has worked in the emergency department for the last 16 years. She's a clinical instructor, department in the clinical surgical sciences in the University of the West Indies. And she's a what we call a basic life support, advanced cardiac life support, and advanced pediatric life support instructor as well. I've worked with her for just about 6 months or so in San Fernando General. She was my boss. Glad to have her here on the panel with us.
And there she is. Good night, Dr. Rita Munisar. And
Hi.
I'm actually missing the full name. Is Rita Munisar Ram? And I seen the full thing here.
It's Ramnan and saying my boys were a little bit, they were like, Mom, you did not add our name to it. I'm
No,
like, okay, we will
yeah.
adjust.
No. We fix that. We fix that, fellas. Go easy. Go easy. Rita, when did you attend Prima College?
Oh, I attended from 1995 to 1997. Was an
So you would
interesting
have
and a really good experience.
so you would have left again as soon right before I entered. I entered in 98. You understand?
Yes, I
So we
think that
all
was
kind
the
of picking
last.
up, yeah, and that was the
Yeah.
last year. So we all kind of picking up the baton, if we would say so. All right. So there's a lot of, how to put it,
But
urgency.
as you
Yeah.
say that, yeah, but I guess
Mhm.
I am the last leg on the battle on the relay team.
Yes, you definitely are. Right? When Metra says his age in executive meeting, everybody's go like, "Oh God, we old boy." And what year he born and thing, it doesn't be good to hear. But there's a bit of urgency right now in the society when it comes to the topic of vaccination, when it comes to the topic of COVID-19. We are seeing right now what's going on with the figures. We are back on a climb, when it comes to cases, when it comes to deaths and all of that. But before we go any further, we have to bring in our last guest, Dr. Navi Moradali. Now, Dr. Navi Moradali is, for most of you, you'd know him as the mayor, all right? Former mayor of San Fernando. He's also the chairman of public health, and he's also the city medical officer. He holds a degree in economics, dentistry, and medicine. Dr. Murdali currently works in the oil and gas sector as an oil and gas United Kingdom physician. He's the founder of virtual wellness and online digital health platform in the Caribbean. Welcome, Dr. Murdali. Good night.
Good night to everyone, and really happy to be here with fellow N.A.P.S alumni.
Yes. Dr. Murdali, what year did you graduate?
Oh, I should have done my research. Okay, so I graduated in 1990. Yes.
Again, right. So it's Dr. West, then you, and then we going down the train there. So right, we see that. So although we all over the screen, we understand the pattern here.
And Mitra has the last battle.
Yeah. So let's just jump straight into it, because I was getting a little too urgent there. I almost forgot to bring you on. So the need for vaccination, right? I wanna direct this to Dr. West, being, the one of the most wisdom here on the panel right now. Dr. West, I want to hit you a very general question. Why should someone get vaccinated?
Well, thanks for the question. I want to just underline something here that people need to be aware. We have at least two pandemics running. We have the obvious COVID pandemic, and we have the misinformation pandemic. And that has spread like wildfire. For people who are on the other side who believe in vaccination, we find it very hard to not to understand how people will not want to be vaccinated. And I think for us to break through the ceilings that we want to, we need to understand and bring them over. So, the first reason, of course, to get vaccinated, and we have a lot of vaccines available. It wasn't like when they started way back in April of 2020, almost a year and a half later, we have huge choices. So the choice of waiting for this no longer exists. So why get vaccinated? Well, and you significantly reduce the effects of being affected with COVID. If you get vaccinated, you significantly reduce the infection severity. And in most cases, it used to be said to be 100%, but we know that's not true at this stage, mainly because of the new variant, the Delta variant, as it's called, which is around the world now. It is very lethal. The signs and symptoms are different as it evolved from 2020. Remember, it started at the end of 2019, came into 2020, went up and down a few times in Trinidad, and as you said, we are now seeing a surge of the Delta variant, which is a very worrying thing. Before we came on, I work at North Central Regional Health Authority, and I was online with a few of my colleagues talking about what are the next steps. We're talking about, maybe San Fernando is doing the same thing, the contingency planning, because we know if this continues, the so-called parallel system with Dr. Abdul Rich has been said, is going to be overwhelmed. So we need to bring this down as quickly as possible. At the moment, we are about 45.6% vaccinating. With that percentage, we are approaching we're knocking on about 2,000 deaths so far. So we want to bring this number under control. Vaccination is the key. It also, of course, if you are vaccinated and you are less infected, in other words, you are less likely to transmit it to other people. So the spread reduces. Another reason to vaccinate, and particularly about women, we've heard about pregnant women. It has been advocated that pregnant women should take the vaccine. Why? It helps them, but it also helps their unborn child. Without taking too much information from some of my colleagues, I'm sure they'll be talking about this, but it reduces the risk of transmission to the unborn child. Of course, another thing that happens when you vaccinate and you reduce the infection rate is that you begin to allow movement around. A lot of countries, like for example in Austria, are bringing in laws to say that everybody has to be vaccinated. Now, of course, if we did that in Trinidad, there would be a huge uproar. But what if the whole country was at risk, which it really is, if we don't vaccinate? Some people have been talking about allowing various sectors of the vaccinated population to enjoy carnival. That's another huge topic, but at the moment, with only 45.6%, carnival has to be off the cards. So if we had more vaccinations, like in other countries like Ireland and others, where 70, 80%, where we are approaching what is called the herd immunity effect, then we might begin to open up even more. And of course, the effects of COVID, as we've seen, is a devastating economic reality. A lot of people have lost their jobs. A lot of people lost their livelihoods. Of course, as we know, that pushes up crime. So there is a direct relationship between lack of vaccination and crime that we're going to see. A very, very worrying thing, because as you know, we have a problem with crime.
Right.
So to try and put it into context, vaccination is the key for the survival of Trinidad and Tobago in the short term, because we are going back up to the numbers. We're going to get even higher. It is a very, very frightening scenario. And I think at some extent, we have all become a little less sensitive to the effects of COVID, and that has allowed this sudden bulge. But it's going to hit us very, very hard. And I don't think we'll have to be convincing. I hope we won't have to be convincing too many people about the need, because it's going to be devastating. 698 people today, or 680? A number with 21 deaths, some of the biggest numbers we've ever seen, and going to get higher.
Definitely. And it's frightening. But all that being said, when it comes down to brass tacks, Doc, what is the average person have to really think about when it comes to the long-term effects of this virus. We're talking about all these different socio-economic effects, which is very much true. But down to the actual virus now, what from your experience and also being, in cardiothoracic surgery and the lungs and all of that, lung cancer, I know you did a lot of work in that field as well. What happens to people who are infected with COVID when they get these long-term effects? Because there are certain people who think they just get the virus, it either take you, it then take you, but sometimes people can have long COVID and all these different things. What can you say about the actual effects and quality of life people can have and the extent to which it can go when you have COVID?
Well, in 2020, it became evident that some people getting over COVID, for the most part, didn't completely get over it, and their symptoms dragged on. Studies have been done, and there is a variation somewhere between 30 to 70% of patients who have COVID will experience other symptoms, what they call long COVID. So the WHO, the World Health Authority Organization, came up with a definition. And they said that long COVID was a persistence of symptoms anywhere between 3 months after the initial vaccine, after the initial infection. And there's a range of problems that you can have. For example, commonest ones is persistent shortness of breath, persistent cough, tiredness, fatigue. Then there's the effect on the main organs, which include heart, lungs, kidneys. There's a disease called inflammation of the heart, called myocarditis, and that can be quite serious, and that causes ongoing tightness and shortness of breath associated with this. I mean, what we found is that this terminology called long COVID is in fact a symptom that you would expect to get with COVID, and it just is persistent. So we have a process called autoimmune disease, where the own immune system starts to attack your body. And this is another form of long COVID. So we have seen a range of numbers. Now, what the government in Trinidad has done is that they have developed a clinic in the east, in Arima, where anybody who is experiencing persistent symptoms can be seen to check all their symptoms. So we, this Sunday, the Thoracic Society of Trinidad and Tobago, in which I was one of the founder members, has an open forum for doctors and can be found anywhere. And we will be talking about this long COVID, and we will be giving some of the statistics involved. One of our members is Dr. Michelle Trotman, and so she has access to the information. So we hope to be able to present some data on what the effects of long COVID in Trinidad actually is. But it will all revolve around the kind of symptoms that I've been talking about. So hence another reason to avoid COVID altogether, if you can, get vaccinated. The big drive today for everybody listening is to get vaccinated. And I'm going to repeat this, as I hope my colleagues will, if you haven't been vaccinated, to get vaccinated. At least that you will have had 2 vaccines of any of the 2 that you want, except the J&J, which is just 1.
All right, doctor. Thank you very much. Mitra?
Yes, so thanks, Dr. West. Lot of information there. And I think the SWRHA does also have a long COVID clinic as well. That
Good.
has been started. I'm not sure about the other 2 RHAs, 3 RHAs. Right. So we're moving on with our program here. Dr. Bisunat, we want to jump to you next. Now, in your field of obstetrics and gynecology, there's 2 main sectors of the population that has an active issue with being vaccinated, an active question of should they be vaccinated, and that's pregnant mothers and breastfeeding mothers. What can you tell our audience here about that?
Hold on there, Rush. Hold on. Right, have you there. Continue.
Nice. Yeah.
Right. So for sure, it has been recommended that all pregnant women, as well as breastfeeding mothers, be vaccinated, and that the vaccine is very safe. Now, to understand So to promote the vaccine, we should understand as well what are the effects of COVID on a pregnant woman and a breastfeeding mother and a baby as well. So first, to let the public know, pregnant women are not more likely at risk to develop COVID-19. However, if you develop it, you are actually at an increased risk of becoming severely unwell. And also, you're more likely, if you get COVID, that you get severe complications such as preterm labor and stillbirth. So also the evidence out there shows that two-thirds of women who do develop, two-thirds of women who get COVID, they don't even have symptoms. And if they do, their symptoms tend to be very mild. But we do have to look at the small sector of women who do become severely affected and unwell. And this happens especially in the third trimester. The third trimester is generally 28 weeks and above. And this is the time when a baby can survive. So if you become severely affected and you now have to then be ventilated, there are serious risks associated with prematurity. So what the evidence has also shown is that patients with symptoms, they're actually 2 times more likely to be born, their babies are 2 times more likely to be born because of the exposure to prematurity. And most of, well, not most, 98% of the time, it's the main reason for delivering a baby. It's because it's to save the mother's life. So it's not that you go into preterm labor, but your respiratory symptoms are so bad that it's recommended that you deliver so that the mother survives. And it has been shown that 1 in 5 women, or 20% of women who have symptoms, actually deliver early. And almost none of the women who were asymptomatic had to be delivered early at all. Also, some studies have shown that women who get symptoms are more at risk of other obstetric complications, such as preeclampsia, which is high blood pressure pregnancy. And then also the increased risk of having a cesarean section, again, to deliver the baby. And risks of stillbirth, and that stillbirth, again, is correlated with a baby being born early. Now, I speak about a baby being born early and prematurity, but a lot of women don't understand that a baby being born early doesn't mean a baby will survive, because the main issue is baby's lungs as well. So what we call fetal lung maturity. And maturity really is gained above, a baby safe from about 34 to 36 weeks. And yes, babies can survive under that time, but a lot of them have to be ventilated. And even babies that survive, say, 28 weeks, some of them actually have severe handicap where they can be blind, they can be deaf. So again, there are issues associated with delivering a baby early. Also to note, which we all know, that COVID affects Blacks and Asians, which is almost the whole of Trinidad. So we are in a very high risk category. Other risk factors are if you're older than 35, your BMI is more than 25, and you have other issues like diabetes, hypertension, that sort of stuff. So that's the effect on the mother. So then they also ask, well, what's the effect on the baby? Good thing that it's unlikely that the virus affects baby. There's no evidence to show that there are any abnormalities of the baby if you do contract COVID. So there are no reports so far. Although there have been reports of early miscarriages, again, some studies coming out of the UK have shown there's no evidence of miscarriages. If someone gets COVID, we then worry about, can the baby get COVID? However, there seems to be protection by the placenta and what we call vertical transmission, which is transmission of the virus from the mother to the baby, seems to be very uncommon. And there have been quite a lot of reported cases of babies getting COVID post-delivery as well. What we have found is the method of delivery does not affect whether a baby gets COVID, which means if you have a cesarean or you have a normal delivery, you're no more likely, the baby's no more likely to get COVID. But I must emphasize, babies who do get infected, they do seem to remain well even though they get the virus. So it's important for us to really recommend vaccination because the mother and the baby can be affected. And what even the evidence from abroad as well as Trinidad is that the vaccines are safe. There are no more increased risks of any side effects to the mother or the baby. And as Dr. West said as well, the antibodies formed by giving a mother the vaccine in pregnancy, the antibodies cross the placenta, and there definitely is a decreased risk of your baby getting COVID post-delivery if you are vaccinated. So, and COVID is on the rise in the pregnant population. To date, only about 900 women have been vaccinated so far. And from our studies through the Ministry of Health via Dr. Surjit Singh, our COVID, the pregnant COVID rate right now is about 905 women, and that was of last week. And of course, there's going to be higher figures this week. So just letting the population know it's about 905 women so far that have developed COVID in pregnancy. While there have been no deaths from COVID in pregnancy, unfortunately, there have been 2 deaths of pregnant two women after pregnancy, so after they were delivered. And it was due to respiratory compromise as well. So again, protecting yourself and your baby, we are definitely recommending vaccinations.
Yeah, I mean, to summarize, that is the effect of COVID is so detrimental on the pregnant mother and the mother just post delivery, and the baby, because the mother has COVID, the detrimental effects is so much. The recommendation for vaccine, the benefit of getting vaccinated way
Far outweighs the risk, yes.
For sure.
And then for even for gynecology, so we're talking about all women otherwise. Many women have reported what you call menstrual irregularities. So prolonged periods, irregular periods, delayed periods, heavy periods. Now, if you think about this, yes, it is causing period problems. But again, it's very, very easy to deal with heavy bleeding or an irregular period versus someone getting getting COVID. So imagine you are worried about a period issue, meaning like a prolonged period, versus you literally dying from COVID. So again, the benefit far outweighs the risk of you thinking about having an irregular period, because an irregular period is very easy to deal with. Whereas if you get COVID, that's far harder to deal with. So again, protecting yourself with the vaccine definitely is recommended versus worried about a period issue.
Yeah,
Right.
I mean, I've had a lot of friends, relatives come to me and say, they had this issue post vaccination. And then a lot of friends come to me and say they're hearing about that issue post vaccination. And my advice is the same. You worried
Yeah,
more
and
about
that's it.
that or COVID, getting COVID? Which one is worse?
Definitely getting COVID is worse than having an irregular period. As I said, any gynecologist or even any general practitioner would be able to help you fix your period. But if you get severely affected by COVID, that's a whole different story.
Yeah. All right. Thank you very, very much,
And that,
Roshni, for that talk.
yeah,
This evening.
I mean, just from my own personal knowledge, I know of someone who lost someone who was pregnant, and the person, unfortunately, was not vaccinated, So I mean, it goes to say that how some people say, well, they're afraid of the vaccine, but then look at what the damage the actual virus is doing, right? The woman and the unborn child were lost. But we want to take it now to Dr. Munasar Ramnarayan. Did I have it correct?
Ramnanan Singh.
Ramnanan Singh, but it's like
Ram
three
Narayan
surnames in
Singh.
one.
Ram Narayan Singh. Yes. Good, good, good.
Ramnanan Singh.
Ram
Don't
Narayan
worry.
Singh.
You'll get
I
it,
have it.
Yadi. You'll get it.
I'll get it. Ram Narayan Singh. Um, Doctor, you have experience on the front line. All right. You know what it is going on with the reality out there when we have to deal with the emergency situations and the emergency department, and when people come in to the hospitals ailing. Doctor, is there a difference in the emergency department when COVID-19 patients come in as vaccinated as opposed to unvaccinated?
Well, Yada, the answer to that question is simply yes. I can't reiterate it enough. Please get vaccinated. To those of you all who are listening, please get vaccinated. You There's a stark difference between the vaccinated and the unvaccinated in terms of presentation to the emergency department. In fact, if you look at the statistics daily, you would see that the parallel healthcare system is inundated and overwhelmed and basically filled with unvaccinated individuals. Now, I understand the concerns, and as Dr. West rightfully says, there's a pandemic of misinformation. So I'm hoping after this little podcast, people will be more enlightened and some of their fears will be allayed, because I think part of getting around that misinformation pandemic is addressing their concerns. But definitely, yeah, there is a stark
Yeah,
difference in the vaccinated versus unvaccinated. All these studies have shown, and we see it physically. Mitchell could attest it as well. When unvaccinated patients come in, they are more unwell. They require more oxygen. They require
right.
ventilatory support.
Mhm.
Whereas you would find those who are vaccinated are able to battle the symptoms and
Yeah.
not be as unwell and sick. And that is what you want. That means the vaccine is working, guys. That is what a
Yeah.
vaccine does. So
Hmm.
again, I'm going to reiterate,
Yeah.
please
Well, a lot
get
of people
vaccinated.
have the misconception that that the vaccine doesn't work because the vaccine doesn't cure if you want to call it cure, it doesn't like get rid of it. It's like you could still get it, and that is a big talking point. That's how you could still get it although you're vaccinated. So what's the point of vaccination? And you said it right there. You will not be needing respiratory support and all of these things that mean that you're critical. And speaking of critical, what is it like in the ICUs? Like when we have these surges in COVID, what's going on in the ICU? What is the sites like, and what is the reality there? You have people who may have other critical conditions, and then we have so much people having COVID and reaching to that point of intubation and thing. What is that like?
So I can speak for the emergency department because that's where I work. I know that the ICUs are filling up and filling up pretty quickly.
Hmm.
And
Hmm.
it is very heartbreaking for the relatives and for the patients when you actually do need to up that level of support and care. And looking at the physical ailments is one thing, but the psychological effects on the families and the patients, and it is devastating to say the least. I'm sure everybody on this panel have known people who have probably succumbed and died because of COVID-19. And we've actually had patients who said, doc, I should have taken the vaccine. But at this point in time, we're at this stage, and all we can
Yeah.
do is offer the best treatment possible. So it is
Yeah.
very stressful on the patients, the families, the staff. It
Hmm.
takes a toll on everyone. And, you know,
Yeah.
it is heartbreaking. It is a very
Yeah.
real situation. And I think there's a bit of a disconnect between what actually happens and what John Public thinks happens.
Hmm.
But it is quite
Yeah.
serious.
Yeah, because you see, that's the thing about the COVID virus. It attacks people in different ways. Some people are asymptomatic, so it tends to, because not everyone gets the same symptoms. People tend to say, "Well, I have a partner; he was good to go." Nothing. That is a small thing. You just drink some punch and whatnot and whatnot. But what should
Yes.
someone expect, doctor? What should someone expect when coming in to the emergency department when having viral or flu-like symptoms?
So we have a lot of signages. Once you have viral or flu-like symptoms, there are signages to direct you to a viral pathway. Um, if you're not sure, everybody coming to the emergency department is actually screened. There's a screening form that you fill out, and if you have any concerns or red flags, you're redirected to the viral pathway. Once you're in that pathway, you are triage, meaning you have your vitals done, your blood pressure, your pulse, your temperature taken, and then you are seen and assessed and treated accordingly. And of course, tested as the need may be.
Beautiful, beautiful. Um, a question for Dr. West. Dr. West, when it comes to this issue of comorbidities, right? A lot of people, they hear that with comorbidities and they don't really understand what it means. And also, do comorbidities point to a greater need to be vaccinated? Hold on there, doctor. I think, oh, yeah, you're muted, doctor. Yeah, just click it.
There we go. All
Yeah.
right. Thank you very much for the question. A very important aspect of the treatment is the understanding that we have these diseases which are very prevalent in our society, called non-communicable diseases. Things like high blood pressure. I have a little pressure, but it's okay. Diabetes. I have a little sugar, but that's all right. Kidney disease, pre-existing lung disease, which is often manifested by smoking. What this does is put the person at increased risk for severe disease. Dr. Munisa would have seen that her patients coming in, and these patients who have these disease processes are more likely to have more severe disease, and unfortunately, these are some of the patients that have died. We in the early phase, we saw that it was almost exclusively older patients with diabetes, so-called comorbidities, diabetes, hypertension, that were dying. This trend has continued. We do have an interruption. We have a breakthrough with some young people who are now dying. And we suspect that this causing an overwhelm in the inflammation system. This is how one of the ways COVID works. You had a massive inflammatory or inflammation from within. It then also affects your lungs. You cannot breathe, and it also causes clotting disorders throughout the body. And many have postulated that this is the underlying mechanism in which it's causing so much havoc. For patients who have these disease processes, it makes them more susceptible because they're already weakened. So for people who have these diseases, I would urge you strongly, one, get vaccinated. Two, see your own doctor to optimize your condition. Many people who have diabetes feel that although their sugars are a little high, it's no big thing. I could manage that. I had it for years. Our sugars are a little high. I'm good. No, you need to bring those sugars very much under control, your blood pressure, visit your doctors and or your specialists to optimize yourself. We in Trinidad, like the world, are at war with COVID. We're at war. And while you like to pat ourselves in the back and say we have a vaccine, the reality is we are exploding. The numbers are just unreal. And until we can get that control, we must vaccinate and optimize yourselves. And I'm very glad that N.A.P. College is stepping forward and trying to bring more information. The more information we can bring to the general public, the better the situation will be. Thank you very much for inviting me. And I think we must continue, as dry as our throats may be, we still have to keep talking to try and convince people, because 45.6% is where we're at. We have less than half. We are better than some countries, but we're not where we want to be. I have already spoken about the terrible economic impact. This is directly related to the lack of vaccination. We must vaccinate if we want to break out of this huge economic problem that we're going to be seeing, and the crime. So for the people who have these comorbidities and for anybody else, please get vaccinated.
Thank you, Doc. Thank you. I think you're muted, Emmett.
Sorry, yeah, you brought up a good point when Dr. Munisa was talking, where there's this misconception amongst the population that because you're vaccinated, you could still get COVID. Yes, that is true, but to me, it's a misrepresentation of the facts. And one of my friends actually did a nice little graphic, a nice little
I'm trying
graph.
to put it up here right now, but I'm not sure.
If you have it there, you could throw it up there now.
I'm trying to. I'm just not sure why it is. I'm not getting it.
That's fine. But if you do get it up, what the graph shows is essentially the vast difference in the amount of patients that were hospitalized, unvaccinated, versus the amount of patients that were hospitalized that were vaccinated, and is saying that you can get COVID while vaccinated, and using that as a point to not get vaccinated is is a very very gross misrepresentation of those facts.
There we go. There
Yes,
we
there we go.
go. All right.
I mean, you could see the difference. The blue line in the graph that you see there is the total is the amount of patients that in the parallel system hospitalized that are not vaccinated, and the very small orange line at the bottom is the amount of patients that have been hospitalized um, that were vaccinated. So you could see the big difference there just from this graphic alone.
Yeah,
Yeah,
well, and this, go ahead, Rita.
and I mean, this speaks for itself, Mitra.
Yeah,
Where do you want your chances to be? Basically, um, give yourself the best fighting chance. We are in a war with COVID. It is a war zone. It is a battlefield. Do everything you can to protect yourself and your family.
Definitely, definitely.
Well,
Now,
just to mention as well, the two ladies that died postnatal, they were both unvaccinated as well.
Yeah, just to add that the figures is 91% of the ICU admissions are unvaccinated. So there's no question there's a huge risk to the unvaccinated population, a disproportionate risk.
for sure. Right. So the next person we have upcoming here to talk to us is former mayor of San Fernando, Dr. Navi Muradali. Dr. Muradali, you are a physician working in the oil and gas sector. You deal a lot with the workplace um, and that side of things. Tell us what is the situation in the oil and gas industry, the offshore industry, and the workplace in a general sense. What are the repercussions of being unvaccinated?
Yes. Well, thank you, Mitra, for the question. Um, I think all of us we try to underscore the point that people need to get vaccinated. And we will say it over and over. You will hear it in all of the Ministry of Health press conferences, all of their information and advertisements. But in the oil and gas sector, um, you have persons who will come in on a daily basis. They need to get offshore, and they vaccinations are not a mandate. It's not a requirement. And unfortunately, many of these companies they pay a huge price when many of their employees they go offshore, and these are confined spaces. So if one person is COVID positive, you have the entire platform or rig being exposed and infected, and you hear that the whole platform has been shut down. What that means to the economy, and it's something that we do not see that effect. But you shut down a platform for 2 weeks or 3 weeks or a month or a rig, you could understand the economic consequences to to us. Not to mention the livelihood. The people who are vaccinated, they are out of a job for a period of time. So now they are now being punished. They're being penalized. They've done what we are asking them to do. We understand the science. We are trying to explain to them, and yet persons who are going into the oil and gas workspaces, many of them are unvaccinated. And I would, based on my um, assessment over the past year, I would say at least about 30 to 40% of persons in the oil and gas sector, offshore workers, are unvaccinated, and that is a staggering number. And
say that like,
therefore,
say how much percent is that again?
about 30 to 40% remain unvaccinated.
Unvaccinated.
And what is happening is that, other than, I mentioned the economic consequences, But you have persons who have to go into this quarantine. That's a company expense. And if it's a state enterprise, you can understand we are paying those bills because people have to go into this quarantine. Then you have to bring people back from offshore, put them into quarantine. It's a process that you are witnessing every day as a physician who has to decide whether or not someone goes offshore based on the guidelines. Vaccination is not one of them, unfortunately. It's not a mandate. We as physicians, we cannot tell someone they cannot go offshore because they are unvaccinated. But when you look at the data and you're seeing the cost implications as well, you all spoke about the health implications. I mean, you also have to look at the cost implications to the company and the state and personal, their personal finances. We cannot, this is unsustainable. This cannot continue into 2022, into the second quarter or to the next year, because, where's this money going to come from? Where are these people going to earn a livelihood? Who are vaccinated and they cannot go offshore because a rig or platform is down because of the numbers, the sheer numbers. So that is one impact. And Mitra, you work in this industry as well. It's not only oil and gas, it's the industrial estates. We see people for the industrial estates. And the numbers are about the same thing. It's about 30 to 40% of people who are employees in the industrial estates who refuse to be vaccinated. And when you ask them why, they come up with the same, Dr. West, the epidemic or the pandemic of misinformation. They tell you things that, when you thought you heard it all, then you have a patient who comes in and then just throws a wrench into the whole thing. You really have to wonder sometimes where is this information coming from? Because, we on YouTube, we on Facebook, you might see a TikTok, but I don't know where this other type of information is coming from. And so I want to appeal to, not only to our N.A.P.S alumni, not to the people who are just watching here, but, please, talk to your friends, talk to your families. There's a vaccination drive that, I must commend you all for the vaccination drive this coming weekend. And I think you will discuss that more. But every day there are vaccines being given out at SAPA in San Fernando. I participated in the vaccination drives at N.A.P.A at the Nagar, but now I think UTT, the paddock, they still do the vaccinations there, your local health centers. If you have questions, you have any doubts, please, as Dr. West pointed out, go to your doctor, call your doctor if you can. If you don't want to go to physically see your doctor, call the doctor's office. I work with Paco in a program right now. It's a vaccination hesitancy hotline. It's 607 VAX, 607 VAXX, 1 p.m. to 7 p.m., Monday to Friday. You can call that number and you will find doctors there, myself included. There are other doctors from Trinidad and Tobago who are there, and they are providing information on a daily basis. I am very happy to report that because of that vaccination hotline, many persons who were in that state of misinformation, they now are vaccinated. And I'm so happy that these, no matter how small you think a program is, like this program tonight or the vaccination hotline, the vaccination hesitancy hotline, no matter how small, if 5, 10, 15, 20 persons become vaccinated, we have done our jobs, because it means that that's one less patient for Dr. Munisa in hospital, one less patient for Dr. West, so one less pregnancy complication for Dr. Bisunat and for Mitra and, for his entire team at the hospital. Because our colleagues are overwhelmed. I talk to my colleagues every day, Dr. Munisa, the situation at the hospital, Dr. West, our colleagues are overwhelmed. Doctors, nurses, the support staff, we are very, very overwhelmed. Even in private practice, having to say the same thing over and over again to clients and to patients. So I really do urge our listening audience, no matter where you are, even if you're not in Trinidad, you need to support what is happening in your own territories. please, if you are not vaccinated, go and get vaccinated. If you have questions, reach out to your doctor.
Okay, at that point, at that point, I want to open the lines now, if you want to call it that, the lines to the public out there to give us your questions, your burning questions that you may have. And I had the wrong number up there for a second there, people. So just bear with me a second. Not on my best foot tonight, apparently. But there we have it, 607 VAX. Is that correct there? That's
Correct.
the number to call, 607 VAX, 1 p.m. to 7 p.m. daily. You can call that number at the bottom there, 607 VAX, to get all the information. When people call that line, doctor, what is it primarily for?
It's for vaccine hesitancy. So
Right.
an operator, this is in collaboration with the Trinidad and Tobago, the coalition of NCDs, led by Mr. Andrew Danu and his team, Dr. Karen Seeley, in collaboration with PAHO and Virtual Wellness, of which I'm a part of.
Right.
And we have gotten some doctors
So
for them.
it's directly to deal with hesitancy. It's not to say
directly to deal with vaccine hesitancy.
Right. Thank you for that. 607 VAX, not two people. That's my bad there. What do you think, from Damian Babulal, what do you think is the main reason that people still do not want to get vaccinated? You're saying 40% of people in the industry, in certain industries and so on. Dr. Murad Ali, Dr. West, anyone want to take that? Why do you think people, Dr. Munesar, why do you think people do not want to get vaccinated? Besides, we know there's misinformation. Is there anything else to that equation?
Well, if I might start, and then my colleagues will join in, there are multitudinous reasons, and we need to tackle them. The first one that bothers me a lot is there is undercurrent among some religious bodies that do not believe that this is the right way to go. Now, this is a very touchy subject because a lot of the leadership of these bodies come out and say, please get vaccinated. However, when you speak to people about it, they themselves have a personal belief that their deity, whatever it is, does not want them to get vaccinated because what it is going into their body is not from natural, it is not from God, it's alien. That is one I have gotten very often. The second one I got is that, nah, man, I will be fine. People just do not understand. My colleagues have heard when people who have gotten sick, they say, as Dr. Munisa was saying, I should have taken it. It takes at least 2 weeks after you have your vaccine for your antibodies levels to rise. And people over that period of time are still vulnerable. People do not believe that they're going to get that sick or die. And unfortunately, we know this can happen. The other thing I think are people are very much afraid of getting a needle stick. They don't like the idea of somebody sticking something in their arm or leg, usually their arm. I suspect that if it was an oral preparation, we would have a higher compliance. So people just don't like the idea of somebody coming on and sticking a needle. We've been in the vaccination queues and we've seen people getting vaccinated, squeezing and fainting. And people, adults are terrified. We vaccinate children because we have them under control. But people don't like it. And of course, there is this idea that if you vaccinate, you're going to have some complication. Again, similar along the deity religious route, they're putting something foreign in your body. And that's it. Now, I'll stop there because I'll let my colleagues also answer.
Anyone wants to chime in on that before we move to the next question?
I actually agree with Dr. West, and I think oral preparation would have probably gone on better. But all of those are concerns that we have also gotten in the emergency department, especially fear being a big factor. A lot of people are quite fearful, and I think more programs like these to debunk the misinformation will assist with those people who are still undecided.
Okay, we see some good questions coming in here. Can you please explain how vaccination will prevent the spread of the virus? Now, obviously, vaccine can't alone prevent the spread, but how could it prevent the spread of the virus? Anyone want to take that one?
Well, my colleagues can answer
this. Everybody, give it that. Dr. West talking plenty. Anybody else?
I'll let happy for my colleagues to take this one. It's straightforward.
I think Metro, we discussed this earlier.
Yeah, we
Mitra.
did. So essentially the vaccination in terms of preventing the spread is not so much that it will prevent spread, but it will decrease the spread. Um, when you are vaccinated, and this is data that is published data internationally. Um, when you are vaccinated, your the transmissibility between you and someone else is far decreased than someone who's unvaccinated. And these studies were done in the most high risk of situations. So, meaning they were done with persons in the same household where no mask is obviously worn in the household, and someone tests positive, and the rest of family were vaccinated and has not gotten the virus from them. Obviously, that's not going to be the case in all scenarios, but
Obviously.
the studies showed that the transmissibility from being vaccinated is way, way, way less than someone who's unvaccinated. Thanks for the question, Darren.
Now we have another Darren, another familiar Darren, Darren Dory asking, and that was from Darren Ramsarup. So Darren Dory now asks, folks, I read that the third dose is different from a booster post. Can you explain? And what are we getting here in Trinidad? Third dose or booster? Good question. So is the third dose always the same as a booster? Is it term booster just to carry on at the next dose? Is it that there's a differentiated thing there, or are they interchangeable terms in that case?
So again, so in Trinidad, we are given two doses here. We are given the additional primary dose. Where the difference might come in with the booster and the third dose is really a difference that the CDC had created with respect to. There's a lot of intricacies in it. Age, immunocompromisation, that would put someone at one level over the next.
Right,
We in Trinidad right now are given an additional dose. So
right,
what you would call a third dose,
right.
which is
No,
from the Sinopharm, AstraZeneca,
right.
Johnson and Johnson, and the
But
Pfizer.
generally speaking, what does the term booster mean? Like it's been used ever since, when you're small, you get a booster shot. What is that? What has that traditionally meant? A booster shot.
So essentially, what it is that if you're not exposed to a virus, so let's use COVID for example, you're not exposed to a virus, your antibody levels will obviously be at zero, right? The antibodies is what fight the virus, right? You get your first dose of the vaccine, your antibodies levels will start. Sorry, you're not seeing my hand. The antibodies levels will start to rise. Um, Now, after one dose, what we found is that it will plateau, and but it still wouldn't be sufficient to combat the virus. So you get the booster or the second dose, and when it plateaus, the antibodies level rise again. And
Right,
what we're waiting to see so far is after the second dose or after the third dose, how how high our antibodies are staying, and
right.
is it going to come down again? And that is a question only time will tell the answer.
Right. So I guess it is the intricacy of the actual jargon, and then the actual
Yeah.
testing and all this thing that comes, and the difference in cultures and thing, and how they treat with certain terms. When we look at can you mix between vaccines when getting the booster, right? So as Coram Danny says here, in inverted commas, the booster, because booster third dose, as we may call it, can you mix? A lot of people just wonder, well, if I take Sinopharm, I could take a Pfizer, you know? People are wondering about that.
So again, in Trinidad, we are not mixing yet. Um, there was the mixing done between the first and second dose, where you could have gotten AstraZeneca, and then gotten Pfizer after. For the third dose, there's no mixing being done as yet. If you have
Right.
that is recommended. Um,
Right, documented. Dr. Murad Ali, from your knowledge and hearsay, I mean, you're a person who's you'd be hearing from all different walks of life, people from different countries, and think what's going on there. Do people mix the vaccines?
Yes, there's again, each country, their Ministry of Health or their public health agency will provide recommendations based on the data that they are seeing. For example, the number of breakthrough cases, that's one of the parameters that they would use. So I am always guided by the Ministry of Health here in terms of
Right.
their guidance with respect to the third dose, what we are referring to as the booster, and the if there's mixing of different vaccines. I because I follow what is happening in Israel, UK. They have done large case studies now. The data is out there where the efficacy of the vaccines they have seen it on the decrease, which kind of justified why we needed to have a third dose or booster.
Right.
But I'm always guided by the Ministry of Health. So when the Ministry of Health puts out their guidelines, that is what we need to follow.
Right. Yeah, I mean that we have to work within the purview of our ministry. All right, that is what we should do. Now, Dr. Munisa Ramnanan Singh, maybe you could just chime in here. Is there a best among the vaccines options that we have in Trinidad? Is there a
The
best?
best vaccine is the one that is available to you and the one that you
Right.
can get. Please take it.
Yeah.
Right. Um, Obviously there would be information on efficacy rates and things that would be out there, but all have proven to
All
show
have proven to
effect.
decrease mortality and hospitalizations, and that is the numbers you should be looking at.
All.
Those are the
Definitely.
numbers that count.
Dr. Bisundat, I don't know if this young lady was missing earlier. So, was there mention of menstrual changes or miscarriages associated with vaccination? What is the local experience with this? If you could just touch on that quickly for her benefit.
Yes, there are menstrual irregularities such as heavier bleeding, delayed periods, earlier periods, double periods.
Right.
There have been the international data hasn't shown to be there any increased risk of miscarriages because the miscarriage rate remains the same compared to previous years. There's no published data on miscarriages in Trinidad with the vaccine. So we
Right.
just don't have the data on that.
Right. Right. So there's no data showing that we could
But
conclusively say that.
international, from where, I mean, we get most of our studies internationally, and there's no increased risk of miscarriages.
Right.
But
And I think she has another question. What is the best approach to COVID-19 misinformation shared by healthcare workers? And that one, I get in a bit of a paradox going on here. Misinformation shared by healthcare workers. What is the best approach to misinformation? Well, your guess is as good as mine in that regard, doctors. Um,
No, I think Dr. West spoke on it earlier. The misinformation pandemic that is going on side by side is a detrimental one. And the thing is, the best place to get information from is the notable websites. So the reputable websites, so the CDC website, the WHO website, the Ministry of Health website. And surprisingly, surprisingly, the Ministry of Health Facebook and Instagram page are actually pretty updated and they have pretty good information on it. I pull a lot of information from it, to be honest.
all right, all right, all right. There we have it, folks. Let's see. Do we have any more questions? Well, we have a lot of thanks coming into the doctors. You all shed a lot of light tonight for our viewers. Did we miss anything? And then Darren said that either way, we should consider getting the third dose. And Mitra, maybe you could just quickly touch on who is eligible for the third dose that we would have had in our information that we were sharing around in our groups and so on. That generally speaking, if people are coming and thinking about third dose on Saturday, right? And as you all would know, we have the drive on Saturday. It is at SAPA. All right, it is running from what? It is from the time, Mitra, remember the time?
Yeah, so the vaccination drive we have is on at Sapo on the 27th, which is Saturday. It is from 8 a.m. to 3 p.m. The vaccines that we will be giving out would be the first dose vaccines. We obviously aiming to give first dose vaccines for the Sinopharm, the Johnson and Johnson, and the Pfizer vaccine. The third dose or the booster vaccines will also be available to those persons who are eligible. Now, this information we will post on the alumni page, so you can get it there. For
Right.
persons who had their two doses of Sinopharm vaccine, the criteria is simple: 60 years and over, everybody can get a third dose 3 to 6 months after the second dose. This is for Sinopharm, right? And you don't need a referral letter. Under 60 years old, for Sinopharm, if you have a moderate to severe immunocompromised condition, you can get the vaccine, the third dose, 1 to 3 months after your second dose, but you must provide a letter from a physician stating your medical conditions. What I will also post on the page is the list of conditions that they consider to be immunocompromised conditions. So things like diabetes and hypertension are not conditions that they recognize to be immunocompromised conditions, unfortunately, but they are comorbidities, which is a little bit different. Right.
Right.
For the AstraZeneca, Pfizer, and the Johnson and Johnson vaccine, all have the same criteria. Essentially, any age, once you have a moderate to severe immunocompromised condition, you can get the third dose 1 to 3 months after your second dose. Right. But you must again provide a letter stating that from your doctor. Right. It is a lot of information that we'll post it. We will post it on the
Yes.
alumni page, so you all can look out for it there.
So you guys follow us on Facebook. You're now seeing this on our YouTube, right? Subscribe to our YouTube. We'll put up more content there. We're on Instagram, we're on Twitter, we're on all major platforms. We are even on TikTok, believe it or not. All right. So, and we are putting a lot of great content out there. I mean, this is the mission of the executive and the alumni association. We are here to make you all feel that spirit of inclusivity, that it's never hard to reach out to us. You want to know something about Saturday, message us on any of these pages. We will get back to you. You can also check us out with your request at info@napsalumni.com. I will put it in the chat. I want to thank all the doctors for coming out here today. I know, Mitra, you had to come, all right? But the rest of you all had a lot of engagement, something that you all put off to be here with us. You all made the time. I know we're running a little over schedule, but we really appreciate it. And I'm sure you can see how much the listeners and viewers appreciate it tonight. So I just want to thank everyone for making this time for us. I mean, things getting a little more, risky out there, but hopefully we can meet at some good time. I don't know if you all are coming up for the brunch. I mean, is everyone here in Trinidad right now? I don't think Navi, you where right now?
Trinidad.
Right. So we have the brunch on the 5th. We can't eat together, but we could probably pick up food and catch a little old talk or something, as the case might be. All right. The brunch is our main fundraiser we have coming up. So we'd like if everyone can try and make it up on the hill and come and take part in the brunch. Try and buy a meal. If you want to get your meal donated, we have that avenue as well. We have online ticket sales as well for those who are stationed abroad. For those who may not be able to come to the college or to reach an alumni member, you all can take it through that gateway. And overall, we want people to also keep in mind our hamper drive and everything that is going on with that. Mitra, maybe you could tell them a little bit about the hamper drive before we close off, and then we will, yeah.
So the date for the hamper drive hasn't been obviously selected as yet, but we will post it up on the alumni social media as soon as we do. We will be accepting donations of cash or kind or of any kind that anyone wants to give to us. The persons that will benefit will be the less fortunate students, parents, past students. We will try to target first, and then the wider community at large.
All right, definitely. So we will keep you all updated on that. So what I said, check us out on all the platforms. We all know through social media now, no matter what age. We know everybody, grandpa on Facebook. So we were supposed to be live on Facebook today as well, but we had a little technical difficulties. We will sort that out. So from all of us here, from the N.A.P.S podcast, we wish you all a good night. Stay safe, everyone. And we meet again in about a month's time. So for all the panel here tonight, thank you so much and take care.
Good night, everyone.
Thank you.
Thank you.
All right.
Thank you. Good night.
Good night.
Bye.